A 2019 study regarding the global burden of cardiovascular diseases indicated some pretty alarming results. The study specifically details the extreme difference between the effect of non-rheumatic degenerative mitral valve disease, a type of cardiovascular disease, on age-matched females and males. This figure from the research here shows us this effect in DALYs, or disability-affected life years. Women generally had higher DALYs than men, as you can see in this figure. For example, at ages 60 to 64, women experienced around 40,000 DALYs, whereas men experienced around 35,000. To put this into perspective, one DALY is equivalent to the loss of 1 full year of health. This means that women are losing 40,000 years of health and men 35,000. As age increases, as you can see in the figure, this difference only increases. And at one point, women are affected almost double that of men. Clearly, both genders are negatively affected by this disease, but women are disproportionately affected. This gender disparity is a rising global health issue, not just in non-rheumatic degenerative mitral valve disease, but in the majority of cardiovascular diseases, and this significantly influences heart health for women worldwide. This important conversation is what I will be shedding light on in my presentation about gender differences in cardiovascular diseases and the importance of spreading awareness about this topic. But first, a quick introduction about myself. Hello, everyone. My name is Akhila Swarna, and I am a rising senior from Marquette High School, which is located in Chesterfield, Missouri. I have been incredibly passionate about cardiovascular disease awareness, public speaking, and global health for a while now. I currently serve as the vice president of my school's policy debate team, our club, and served this past year as the Vice President of HOSA Future Health Professionals, the Marquette chapter of HOSA Future Health Professionals. I am also one of the youngest members on the Missouri Advocacy Committee for the American Heart Association, and am launching a monthly blog that explains the youth perspective on health issues. In the future, I hope to become a cardiac surgeon and continue to contribute to the global health community. So for a quick overview of my presentation, I will be initially providing some background information to make the content easier to digest. Then I will discuss the gender gap itself, and finally offer potential solutions and also just explain our role as youth and global citizens in this issue. Now, you may already know that cardiovascular diseases, or CVDs, are a group of diseases that affect the heart and blood vessels. You may also know that heart attacks or strokes are just a few of the many cardiovascular diseases affecting us all today. But what you may not know is that CVDs are the leading killer worldwide, with around 17.9 million people dying from CVDs in the year 2019, according to the World Health Organization. This makes cardiovascular disease a pertinent global health issue, affecting all communities and populations around the world, obviously to varying extents depending on factors like socioeconomic status or race. You may also not know that most cardiovascular diseases are actually preventable. In fact, with more education on its causes, we can reduce your risk and everyone's risk of CVDs and hopefully decrease the number of deaths each year by learning about the causes like unhealthy eating habits, lack of physical activity, substance abuse, or underlying causes like diabetes or hypertension. So now that we've discussed a little bit about cardiovascular diseases, let's move on to a discussion of the gender gap, or gender differences in the mortality and treatment of CVDs. So the global health community can come to an agreement, for the most part, that women are being disproportionately affected in cardiovascular diseases when it comes to treatment, mortality, and many other ways. However, we are still not able to understand the causes or reasons why this happens. So, current research suggests that biological factors are one of the major causes, more specifically, sex differences. So, sex differences are actually biological differences between men and women. So, a good example of a sex difference between men and women that I'll be using to kind of explain this cause of CVDs is menopause. So, menopause is a natural time that marks the end of a woman's menstrual cycles. So, during menopause, estrogen levels of women are significantly dropped, which causes many negative side effects and can ultimately increase the risk of heart disease. This is because there is a lack of hormonal control in the body and therefore on cardiovascular function and metabolism. Low estrogen levels can actually increase cholesterol levels, which can therefore further increase the risk of developing heart disease. This is because, as you may know, cholesterol is a key determinant in cardiovascular diseases. The menopause also adds to the already existing risk factors of CVD. So therefore, the greater mortality of women as opposed to men in CVDs can be attributed to sex differences and biological factors, as seen in the example of menopause. Now, these sex differences and biological factors can ultimately lead to consequences in the treatment of cardiovascular diseases. So disparities can also occur in treatment, for example, with inadequate screening or ultimately an untimely diagnosis of CVDs, and thus a less appliance of CVD drugs that can actually treat and help these women and reduce the mortality rates. So another cause of the gender gap is the social stigma surrounding women and heart disease. In the 1960s, many misconceptions arose about heart disease, stating that heart disease was a man's disease. And this spread in the medical community and to the public. As stated by well-known scientist Dr. Sharon Hayes, who is a cardiologist and founder of the Mayo Women's Health Heart Clinic, this led to research almost exclusively focusing on cardiovascular disease in only men. In fact, many clinical trials in the 70s and 80s completely excluded women or did not make an effort to include significant numbers of women to draw sex-based conclusions in cardiovascular disease research. So this gender gap will ultimately continue to disproportionately affect women across the world if action is not taken. So the good news is that research is starting to gear more towards sex and gender-specific research. And this momentum needs to keep going because this will involve better treatment about sex-specific causes of cardiovascular disease. Another solution to the gender gap is beginning healthy habits such as healthy eating and exercise. And finally, and most importantly, it's awareness. Awareness is a necessity. And although it is impossible to fully diminish the gender gap, since it's so rooted in biological differences, it is essential to spread awareness about the issue to better prepare women around the world. And that is our role as youth and as global citizens. It is to spread awareness about this issue. That concludes my presentation. Here are my references. I would like to express my deepest gratitude to the Global Health Leaders Conference for this opportunity and to you, the audience. Thank you so much for taking the initiative to educate yourself on the gender disparity in cardiovascular diseases. I hope this was informative and prompts more research and awareness about this pertinent issue. If you have any questions, please feel free to email me. Thank you again.